to my channel. My name is Stefania. If you're new here, we talk everything about beauty, lifestyle, and nursing. So today our focus is going to be mainly on pros and cons of working in the operating room as a circulator. So if I look down, that's because I have it written down. So the first pro that we're going to start with is being certified by AORN. So once you go through the perioperative program that is usually provided by your hospital, and not every hospital has the perioperative program. So if you are interested in becoming a circulator, just make sure that the hospital you are going to work at offers the perioperative program. So once you complete the program, you take an exam and you are certified by AORN. And AORN stands for Association of Perioperative Registered Nurse. So they give you a certificate basically saying that you have completed the perioperative program and now you are officially specialized as a perioperative nurse. Now, a con that I have to share is that you are not really using your nursing skills once you start working as a circulator. You're just not developing those skills that you learned in nursing school. So skills like administering medications and you do assess the patient. It's a quick assessment. It's mainly an assessment of their skin that we do at the job, just making sure that you look at their skin before before you prep them for surgery and then after they have finished the surgery, just to make sure that they haven't developed any pressure sore or no new bruises, no new skin tear, all those things like that. You want to be able to assess their skin. Going back, you're not administering medications. You are administering medications in terms of handing it to the scrub and the doctor uses the medication. And you're also working alongside the anesthesiologist. So they do most of the administering all the medications. So they're giving the patient the antibiotic and they're giving the patients fluids and whatever they need to give them to control their blood pressure. The nurse anesthesiologist is the one that's mainly taking care of the medication administration. So you as the nurse are not really administering anything. You are though putting in a Foley, and that's not going to be every surgery. So I would say that's the main thing that I do is put in Foleys and assess my patient's skin to be able to notice any changes after surgery, if there are any. So that's a downside, is that as a circulator, you're not really using those skills that you learned in nursing school. So that's a con. Going back to a pro, I have that working as a circulator, you have a flexible schedule. Now, it can be a pro and a con. The way that it will be a pro is depending on the department that you work in. For example, I work in spine. I work in ortho spine. And so our department is not open on Fridays. It's not open on the weekends. So we are off Friday, Saturday, Sunday, and we are also not on call. Now, the con is, let's say you work in a different department where they require you to be on call. So being on call is when you basically are under a surgeon's schedule. So let's say there's an emergency surgery that needs to happen at 5 o'clock after your shift is over. Well, because you are on call with that surgeon, you have to come in. So they usually have certain qualifications to be on call, but not every department is this way. And our third pro and con. So the pro is that you have one patient at a time. So of course, that's the only way you can do it, is one procedure at a time, which is nice because you get to truly focus on that patient. Everyone in the surgical team is focused on the patient's well-being, making sure that the environment is safe, everyone is doing their part, and that is the great thing. It's not like working on a med-surg floor where you have 5-6 patients. It's not like that at all. It's not like working bedside nursing. It's completely different, which I love. The fact that you're able to really get to know your patient, even though it's for a short period of time, but just knowing that, okay, my focus is on this patient right here, and everyone on the surgical team is on board with providing the best care for this patient. And the con is that you may be assigned to a specific surgical team. Now, if you're assigned to a specific surgical team, you only work with that surgeon. You only work with those scrub techs and those CRN and CRNA. You're not really exposed to any other surgeons. Let's say you want to travel after working at your hospital for 2 years, after completing your contract with your hospital, and you want to go ahead and travel and make some extra money. Well, the idea of having to work with one surgeon for 2 years and not really being able to expose yourself to different surgeons, it gets hard when you're in that position where you kind of have to learn everything again. Learn the new surgeons that you're working with, learn their perks, learn what kind of medications they use, learn about the type of equipment they use for certain procedures, because it's not the same as the surgeon that you've been with for the last year or two. When you're with a surgical team, you're assigned to a surgical team, you get comfortable with them. They trust you, and your surgeon trusts you. They don't question the things that you do. Now, being a circulator is definitely, it can have its perks. So you are certified as a perioperative nurse, and a lot of hospitals, when you are a specialized nurse, they pay you more. And it can vary from state to state, from hospital to hospital. And having that certification that verifies that you are a perioperative nurse, it can come in handy because it can increase your pay since you are specialized in a specific area. Now, a con, sometimes the amount of assistance that you need is not really available to you. And as a circulator, you really need a team that will help you out. And it doesn't have to be like 5 people or 3 people. It could just be an extra person. But when it comes to being a circulator, there's a lot of positioning that is involved. It could be positioning for doing a knee or a hip or an elbow or spine surgeries. And you need positioning help. You'll need positioning assistance. So depending on where you work, that assistance just may not be available. And that is where it can be difficult at times, just knowing how to maneuver around situations where you don't have as much as assistance as you need. That is all that I had to share with y'all today. Thank you so much for watching this video, and let me know if you are a perioperative nurse or aspire to be a perioperative nurse. And then if you're interested in perioperative nursing, I would say go for it. I highly recommend it. It's a different world, but it's a world that I enjoy. So you won't ever know where you fit in or which department you will like in nursing until you try it. I really hope y'all enjoyed this video. Don't forget to like and subscribe. Thank you so much for watching, and I'll see you guys next time. Mwah.